Everyone. My name is Araceli Sepulveda, and this is my M5 speaking to the public discussion forum. So my initial reaction to this assignment, I was not thrilled about it. I don't think that I have a problem speaking in public, and for the most part, a lot of the duties related to my job involve public speaking. So I am a insurance representative for a dental company here in Texas called MCNA Dental. And what we do from time to time is we set up education trainings in healthcare facilities or in dental offices that have a large need for it. And we're just educating the office staff and patients on the importance of dental health. So I feel really comfortable with that. But on the other hand, speaking and being recorded and recording myself where I'm able to kind of critique myself as the video plays out, it's definitely something that's not my strong suit at the moment. So I really appreciate that we've had more opportunity to do that in this class, because it's really just strengthening the skills that I had already and learning and acquiring new skills that are going to help me in the long run. As far as public speaking and its direct link and importance to health communication, I think that it's probably one of the most important tools that we can have and continue to utilize for educating our patients. So the reason that I think it's so important is that it allows for a direct involvement, so that you're available should anyone in the audience have any questions. It allows you to really empathize with those patients and just kind of experience and hear, from the horse's mouth the issues that they're having, and then you can go ahead and educate and implement the ways to improve their overall quality of life. So according to the Department of Health and Human Services, health communication is seen to have a relevance for virtually every aspect of health and well-being. So when I read that, it just made so much sense to me, because I think healthcare has really transitioned for the better from the old, where you kind of only received health communication in pamphlets when you went to visit your physician or clinician, whereas now that information is kind of in your face everywhere you look. You can receive health communication and education information on the internet. You also have access on radio, through television ads and commercials. It's available in the newspapers. So one of the great things that resulted from this kind of mass communication of health information are a lot of the intervention plans that resulted from that. So public interventions for HIV and AIDS. So before my current job, I was working for a nonprofit here in North Texas that offered dental benefits for patients with HIV and AIDS. So that kind of gave me a lot of information on the necessity for involvement in not just dental, but every aspect of healthcare for patients suffering with HIV and AIDS. It's a really brutal disease, and with these prevention steps and interventions, you're talking about improving the quality of life for those individuals and also potentially extending years of life for others. So it's very, very important, and I was grateful to be a part of that. As far as more information just available and resources, it just expands the accessibility for those folks who thought, I won't seek healthcare because it's not available to me, or I'm going to have to kind of go out of my way to reach that. So it spreads and allows access to resources for just everyone in general. And I think that knowing that more of those resources are available, it's kind of encourage patients and individuals to seek out that care. So it's just influencing positive behavior. So it was definitely a win-win situation there. It also, communication in healthcare and education in that aspect has a really, really profound impact when you're talking about the clinician and patient experience. So, according to the Institute for Healthcare Communication, they say that extensive research has been shown that no matter how knowledgeable a clinician may be, if he or she is not open, being able to open a good communication with the patient, he or she may be of no help whatsoever. So I can definitely vouch for that one. One bad experience with the clinician or a doctor is definitely going to leave a bad taste in your mouth. So what that did for me is it kind of pushed me to not want to seek healthcare when I was feeling those symptoms again, just because I remembered how I felt when I left that first visit. Felt very ignored. I felt like my issue wasn't addressed. And then I felt uncomfortable speaking to my physician about the problems that I was experiencing. So I'm sure that probably, and of course, many of you have probably experienced this as well, but I feel like that definitely led to a worse health outcome because I wasn't as willing with the information pertaining to my symptoms, so that the end result was that the physician wasn't able to give me a correct or maybe a full diagnosis. So having those good communication skills, I feel, is very imperative in healthcare. So along with learning about disease, how to prevent and treat diseases, I really feel like it's important for our clinicians to go through some training on how to openly and effectively communicate with their patients. And for improving on my public speaking skills, I think that I definitely need to just kind of stay focused and find out what it is that that specific audience or that population is going to respond best to. And I did get some information from Forbes that says that before you start working on your script or your presentation, you want to get clear on its purpose and what exactly you're trying to achieve. So by doing those things, you're going to allow for more engagement from your audience, and most importantly, a lot of retention on the information that you're providing, because that is the ultimate goal, is to make sure that you establish that connection and that people feel like what you're discussing is important. So overall, healthcare and communication, I feel like, go hand in hand. So I'm going to continue to work on these things to improve my public speaking skills, so that I make sure that anytime that I'm educating, the message is definitely clear, and that is going to potentially, hopefully, improve the health outcome for those individuals.